Welcome to another edition of Northern Business Leaders in association with the business services firm Deloitte. Today we're visiting Sterling Pharma Solutions, which is based near Cramlington in the northeast. It's a very good long-standing firm that serves the pharmaceutical sector in all sorts of ways. Let's talk to the people who run it and see what they do. We start our visit to Sterling Pharma Solutions in one of the labs. We're in high vis because we're going to some of the other production facilities soon, but we're with Chief Executive Kevin Cook. Tell us about this lab. What are we seeing here?
So in this lab, this is a lab we built, about 2.5 years ago. It's part of our material science centre. So we are involved in milling, micronization, and also really understanding some of the technical aspects of the solid state of some of the products that we manufacture here.
So let's talk about the end products that come out of the production facilities here at Sterling Pharma Solutions. Who is the client and what kind of products can they expect to receive?
What we are manufacturing or what we are developing is the active ingredient that goes into the tablet. So we don't manufacture the tablet, we make the powder that actually makes a difference. Customers come to us to develop that small molecule. So from a chemistry point of view, we can come up with the route to manufacture that, or they will ask us to manufacture a product that they have developed, and they will give us the technology, and we will use our customers' technology to manufacture that product.
Now, obviously, the end users, the big pharmaceutical companies that you discussed, need to have a huge degree of trust in you, because in pharma, even more than in the food chain, you have to be able to trace the ingredients right back to source, right back to this lab. So what measures do you manage to undertake to fulfill the customer's expectation that these drugs are really safe?
So everything we do is highly regulated, whether it be from a safety, an environmental, or a good manufacturing standpoint. So we are regulated by the MHRA, by the FDA, and we have to have traceability right back to supply base all the way through to the keg of finished product that we manufacture.
Fantastic. Now, in terms of scale, there's been huge growth in that. We'll hear from your finance officer soon about the numbers, but what has caused the sudden growth? Because it is relatively sudden, the last few years, where you've exploded in terms of employees and contracts.
Yeah, we started in 2016 with one site, this site based in the northeast of England, with about 300 people. And today we now have 5 sites, 1,350 people, and on this site we have 680 people. So we have seen really good growth. I think our offering and our capability really matches the needs of the industry. We've got a great ability to handle complexity. We've got a great ability to handle hazard. And as new medicines in the marketplace are becoming more complex, our experience and capability is really well positioned to satisfy the needs that are required to manufacture that.
We'll see the manufacturing facility in a minute, but it's clear you employ scientists as well. Recruiting and keeping scientists in the northeast, how have you managed to do that? Because we need more of the brains that make these businesses work, don't we?
Yeah, so more than 50% of our workforce in the northeast here is educated to at least first degree standard. We've built up good relationships with local universities, so that can act as a talent pool. But also we're a really big believer in developing and investing in youth. We have over 70 apprentices working on site today, and they're from just finishing school all the way through to completing part-time degree courses. So what we're trying to do is attract new talent, but also develop talent and promote talent from within.
Fantastic. So this is the starting point, the labs, the drugs that are subsequently manufactured for your clients. Can we come and have a look at the manufacturing facility?
Absolutely.
Thank you. Kevin, we've come into a very technical looking building. What's this building do with all its pipes and dials and pressure gauges?
So what we've come into is our small scale manufacturing facility. So on this plant we manufacture batch sizes from about 5 kilos up to 100 kilos.
Of course, small scale is quite valuable, isn't it? Because it depends what kind of drug it's going into.
Small scale is very valuable. And we're producing a lot of material on this facility that are supporting clinical trials of the next generation of pharmaceutical products. So we provide product that's going into phase 1, phase 2 and phase 3 clinical trials. And also we're manufacturing some low volume commercial products as well, whereby the annual global demand may be only 100 kilos per year because of the indication that it's treating, or the potency of what we're manufacturing.
So these low volumes and these low batch sizes are obviously in this building, but if someone was to drive past your facility in Cramlington, they would see vast buildings with pipes and pressure and storage tanks. So what scale can you go from? You've got these small volumes, what's the largest?
So our smallest commercial API is 1 kilo per annum. Mm-hmm. Our largest commercial API is 100 tons per annum.
Wow.
And we do everything in between. So we've got a great range of manufacturing scales that we can put to use on this plant.
Now, you've been in this industry for many years now. What was the career that led you to being the CEO here in the Northeast?
Well, a long time ago, I am from the Northeast. I studied at Newcastle University, and a long time ago I used to be a chemist.
Right.
But not a very good chemist, so I had to get out of the lab pretty quickly. And I guess I spent most of my career in operations, so running and managing buildings like this, so very much an operational background. Over my 30 years of being associated with Sterling, I guess that experience has helped me to progress and work in different parts of the business. So I've got a good overall view of what it takes to take a molecule from an idea to producing that end product.
That's an interesting story, because you haven't been parachuted in to run the shop. You've actually grown up in the business.
Absolutely.
It's a story maybe some of your apprentices will be interested to know, because it means, from the basis of what you've done, that you can come in the front door and become the CEO.
And I think, again, the fact that Sterling has invested in me, and we're very much about investing in youth and developing people on site as well.
I tell you what, it's great to see some of the technology here and great to see the scientists, but I know there'll be a sort of other skills in the business to run something of this size, maybe white collar skills. Can I meet some of the other people?
Absolutely. We'll go and meet our CFO and his finance department.
Well, we're lucky on this edition of Northern Business Leaders to be talking to two Northern business leaders. Here at Sterling Pharma Solutions, we've got the Chief Finance Officer, who is Tushar Jain. And now, Tushar, what does the job involve? CFO?
Yes, I'm the CFO at Sterling. I run the finance department at Sterling. Proud to be part of this business. We're about 1,300 people, 1,350 people, in fact. We're recruiting at the speed of light.
Right. And of course, this is the headquarters, so the finance for the whole of the group is based here, yes?
Absolutely. The northeast of England, in Dudley, this is the headquarters, where we have about 680 people now.
Wow. Now, the roll call of your employees is, as I say, well over 1,000 people, and more than half, or almost half, in the northeast of England. What kind of impact does that make to our local economy? The wage bill, for example, are the wages in line with normal wages here?
Oh, it makes a huge impact. 7 years ago, I remember we started off with 250 employees in this site, and today we are about 680 employees. In a short span, we've added a huge number of employees. The average wage is almost double what the local average pay is here.
Wow.
So we are a huge, high-paying company.
So you are levelling up in action, because these wages, these disposable incomes are going to be spent in our local economy.
Oh, absolutely. They'll be being spent in our local economy, and it's great for the northeast of England. We're extremely competitive in the marketplace, and we have some great disciplinary, great experience around here. And it's great for pharmaceutical manufacturing in this area, actually.
Now, you have moved here from a very well-known company, our own sponsors, Deloitte. You were working at Deloitte. What convinced you to come out of a blue chip, one of the big four accountancy practices, and work in a business in this field?
Yeah, I was privileged to start off my career with Deloitte. I was there for about 3 years, got my basics right. Very soon realized I want to make the real impact. Love the pharmaceutical industry, always wanted to move to the pharmaceutical industry. Deloitte gave me the opportunity to work in various sectors. I always had an inclination towards the pharmaceutical sector, and thankfully I ended up here, which is great.
Now, you work in finance, and every organisation of this scale needs to have a CFO like you. But what is the difference for you to work in pharma? Why did you choose to do that?
The pharmaceutical industry always, like I said earlier, is always an industry which always thrives. When jobs are not there, when people are down, they always need their medicines. We need to save lives. So I always thought as an industry, it had huge resilience, and it is saving lives. So for me, it was the right choice. It was an ethical choice, and it's paid off. I'm very happy with my choice that I'm here with Sterling.
Well, after talking to Tushar, we've come back outside at Sterling Pharma Solutions with Kevin Cook, who's the CEO, to finish off. Kevin, you've obviously got a great team of senior people here to make it hum as a great northeast business. But when we look to the future, behind us, we can see you're building the future. What is this new plant that's under construction?
Yeah, so what we're building here is some new hydrogenation capability. So hydrogenation is a step within a multi-step chemical synthesis. So we're seeing additional need for that. So we've built new hydrogenators, and we're expanding our hydrogen storage capacity as well. So again, giving us more capacity and capability for the future.
You can see behind us this capital investment, and there's people milling about as you've got a thriving, enterprising business. But what kind of capital investment is required year in, year out to keep it going forwards?
So across the group, which is 5 sites, we're spending about £30 million a year on routine investments. And on top of that, there could be some specific strategic investments that we make as well.
Well, look, it's been brilliant to see such a fantastic example of Northern business leadership here at Sterling Pharma Solutions. Thank you for showing us around, and all the best for the future.
It's been my pleasure, and thank you.